Just a little update here on day 3. I've had 3 treatments so far. The second one went relatively well. We did increase the dosage, and also I had some oral blood pressure medication before the treatment, as during the first treatment my blood pressure went up a little bit, so they felt the need to give me medication to control it for the second treatment. The medication did make me feel a little bit dizzy during the treatment as well as after, but overall I tolerated the increase in the ketamine okay. I did notice lots of thoughts coming through that had kind of been there or been talked about with people, and feelings, and I noticed that I actually allowed myself to explore them during the treatment, which was different for me, rather than putting up the wall that I normally put up. And the same thing happened with the third treatment, but even more intensely. I declined the blood pressure medication for the third treatment with the understanding that if my blood pressure went up, they would come mid-infusion and give me something to control the blood pressure if needed. But I felt that the medication they'd given me during the second treatment really impacted the treatment, so I requested not to have it, which I think was the right decision, because the treatment today was definitely eye-opening and definitely did do some shifting in my thinking. I was definitely able to explore my grief quite a bit, actually, with this treatment. It's difficult to explain, but it just kind of, I feel like it kind of allows thoughts and feelings and experiences to kind of come through and allow, it's allowed me to explore them and feel them versus the wall that I would put up prior. If anybody tried to help counsel me or coach me or talk me through grief, there were a lot of walls that I put up around guilt, and it wouldn't allow me to look at the grief any other way. And I'm really finding, and I really found, I should say, with this third treatment, that I was able to really explore my thoughts around life and grief, and it really kind of changed my thinking a little bit. It's again difficult to explain, but it's almost like it wipes away my previous thoughts or my thought patterns, and kind of allows me to replace them with different ones that are not unfamiliar, but thoughts and feelings that have been there but I haven't allowed myself to feel or explore. So it was quite emotional today. The tears were just flowing. I wasn't sobbing or crying or doing anything that some may find embarrassing or uncomfortable, but I just did get the sensation of or feel the tears rolling down my face as I was going through these feelings and thoughts during the infusion, which I had asked about after the second, or before the second infusion, if being emotional is common or normal, and they reassured me it was. So during the third treatment I didn't try to stop it, which I kind of did during the second, and it was definitely, I want to say, eye-opening, and making me realize that maybe this is kind of helping or shifting my thinking. But of course it's only the third. In terms of my mood, I would say that I'm probably sitting at about 3 out of 10, 4 out of 10. I feel a bit lighter, a little bit clearer. And in terms of the thoughts of not wanting to be here, not feeling worth being here, and hopeless. Um, I have to say they're less frequent. They're still daily, but they're not every other thought, or yeah, they're less frequent. So that's definitely a slight change. So I'm looking forward, I guess is a bit of a strong word that I generally haven't used before, but or in a while, looking forward to tomorrow's treatment to see if things continue to change, and yeah, and I will touch base after the 4th treatment.